hope you can hear us now. We've had a few technical difficulties. We apologize for that, but we are here now. And you have found us on The Map, the Mental Health and Addiction podcast. I'm Kimberly Walsh, and I'm here with my co-hosts and good friends, the amazing Andy Panda Bernstein,
whoop, whoop,
and the incomparable Chris Long. So for those of
Hi.
So for those of you who are new to the podcast, just a little background about each of us. Chris Long has been in this industry for many years, dedicating herself to working with families and helping people get into treatment. Andy has been an advocate for changing the landscape of mental health and addiction, both as the producer of Cross-Check Radio with hockey legend Kevin Stevens and through his own experiences. As for me, I have many years of experience in the recovery industry, and I now own and operate Brady's Landing, which is a sober home for women on the Cape. So we put this podcast together basically because we are passionate about reducing the stigma around mental health and addiction. We believe that the more light we shed on these topics, the less people will shun, ostracize, and otherwise punish those who suffer from mental illness and addiction. We will have the live chat open today, so please feel free to ask any questions. We will be monitoring the screen. And remember to tag your friends and share this link with people who might benefit from the information we're providing. So before we introduce today's guest, we'd like to check in with one another. Andy, how are things going? Chris?
I'm good. So, where I was in New York yesterday, which was crazy. I had to go down on a bit for business, pressing business. And I was down, and the city was a ghost town. But I'm very encouraged because being in the epicenter of this thing, wore my mask, but they were building, and they were building a lot. So I feel like they're going to bounce back. If New York bounces back, I think we're going to be okay. That's how I feel. Like it was very positive. It was something I needed. I love the city. I was walking up and I walked like 25 blocks, 30 blocks. And it was so cool doing that. It was exactly what I needed. So I'm in good shape today.
Nice.
And my birthday's on Friday. So yeah.
Happy birthday.
Thank you. It's the golden anniversary of me.
Isn't that like the paper anniversary or something?
No, that's the silver.
Yeah.
Something like that.
I'm just giving you a hard time.
I know. I love it. I know. I'm good. Feeling good today.
Good.
How about you?
I'm all right. I had like a crazy weekend. I put the phone down and did a ton of work with my husband. We spread like 6 yards of loam on the lawn, built some raised garden beds, planted them, like crazy stuff. Just burned a lot of energy, pent up energy. So it was good. It was really good.
Nice.
What about you?
What about you? Yeah. What about you?
Well, I've been working with my clients here, and we've been doing a lot of walking, a lot of exercising to keep the good chemicals going in the body, and just staying healthy, enjoying a lot of outside activities. We did the lawn yesterday, so everything's mowed and looks beautiful. We've been planting, cultivating plants and flowers, which is awesome, and really just enjoying the weather finally.
You were marching like in stripes, left, right, left. No, I'm kidding. That's awesome. Yeah. How are the clients responding to it? Do they like it?
They hate COVID.
No, but as far as the walking and
loving the walking and the games. Like we've got cornhole out, and when it's dark or not, the weather's not cooperating, we play pool or darts or whatever.
That's
and
cool.
We've just been enjoying ourselves. Really fun.
Nice.
Awesome.
Yeah.
Nice. So guys, I'm like a news hawk. I'm always looking what's out there in our little world. And I actually read an interesting opinion column in the New York Daily News. It came on May 21st. And we didn't do a show on Friday. So I thought I would at least share this with you guys. And then we'll talk to Danny, and Kimberly will take the lead on talking to Danny. But in the meantime, so here's the opinion piece. The coronavirus is fuel on the nation's opioid addiction fire. And this was an opinion written on May 21st by Marsha Lee Taylor. She is the Chief External and Government Relations Officer at the Center on Addiction. And so it starts with Melissa Etheridge announced that when her son died of an opioid, it brought back to the nation that the addiction crisis is taking on families and not just Melissa Etheridge's. But some of the interesting facts is, or her commentary was, unfortunately, the coronavirus pandemic is fueling the fire of our national addiction epidemic. Overdoses are on the rise. The combination of social distancing, increased financial stress, loss of work, lack of structured time, and uncertainty about the future, plus coupled with disruption to traditional and local healthcare services, creating a perfect storm for existing mental health and addiction struggles. Now, here's the key stat. Roughly 70% of Americans reported moderate to severe mental distress in the past month, which is triple the rate of 2018. And they're saying more Americans are turning to substances to cope with the pandemic-induced anxieties. And then nationally, which we've talked about on the show before, the alcohol sales have increased 55%. And in California, marijuana deliveries have increased 115%. So she's saying, obviously these indicators point to a substance use and mental health crisis that we can no longer afford to ignore. So 2 weeks ago, a report came out from the National Overdose Detection Program indicated that overdoses increased an average of 20% between January and April of 2020 compared to the same period last year. And that comes from the Wellbeing Trust and the American Academy of Family. The physicians, pay attention. The physicians recently predicted that deaths from drugs, alcohol, and suicide, the deaths of despair, have been on the rise and will increase by another 27,000 to 150,000 total by the end of this decade. So obviously the system is broken. And so one of the things she says is, it's lack of insurance coverage, inadequate supply of specialists, subpar reimbursement for services, insufficient training for healthcare providers, poor oversight of treatment quality, stigma against patients, and the treatments that are most effective all add up to a system that is ill-equipped. And then never mind the COVID. So she believes Congress needs to provide adequate funding for mental health and substance abuse services and have a public health approach to address it. And so that's kind of the issue. And while it's been laid out by Trump and Obama in previous reports, it's a problem. So I'm throwing it out to you guys. What do you think about that?
Well, I'll just say that, this is nothing new. Like, this is not new news. It's been put on the back burner on the extra stove, in the back of the trailer, and it has nobody's talking about it that has any particular power. We are all talking about it. Right. We're all talking about it because it's on our forefront. We're seeing it every day.
Right.
I mean, treatment centers are full. Like, they're busy.
Sure.
But this next wave that's going to happen it's scary. It is like, it's almost like I don't want the economy to open up because I'm scared of what's going to happen, because we've already started to see it. The suicides are going to they're going to skyrocket. They're going to absolutely skyrocket.
Yeah. I mean, you read about 23-year-olds. Whenever I read a paper, an article in the paper, like I read something today. I told you I'm a news hawk. I read an article today about a kid, an actor, a soccer player, 23 years old. Family respects private, would like you to respect the privacy of the family at this time. Well, what does that mean, right? It's either one of two things. It's either an overdose or suicide, in my opinion, because, privacy. I'm speculating.
Right.
So so we've got all this negative. What's the
that's
solution?
what she's saying. We need Congress to, we have the roadmap. We know what we need to do, but we need Congress to really get behind this and improving their best practices and really try to get behind it. Now, how do we do that? I think you have Cindy Friedman, State Senator Friedman, who is awesome, and she's she passed a bill. They're passing a bill. They're working very hard at it, but I think continuing to do what we're doing, because you can only control what you can control, to make it to the forefront. But yeah, I mean, I'm sure Danny might have some thoughts about it too when we get to Danny, because he works in the industry. So
Yeah. Why don't we bring him out now? It's a good segue.
How about that?
Danny, are you there?
I am. Can you hear me?
We can hear you.
Okay.
No video though, just your picture. Is that what you
Really?
intended?
No.
We want to see that face, Danny.
There we
There
go.
he is. There
All
he
right.
is.
Spot on with everything you folks have been talking about this morning about mental illness and as somebody said, this has been ongoing, but this certainly, the COVID has fueled the fire, if you will, and that wave is coming. Right now I'm busy. I'm still making referrals to treatment, working with impaired professionals, young adults, older adults. I mean, it just doesn't, it's ongoing. And we're starting to hear more of the anxiety, the depression, the uncertainty people are really experiencing now. And, the Karen Treatment Center, as you know, I'm the regional vice president for all of New England for Karen. And I have like 6 or 7 of us on the ground, boots on the ground, running at different capacities at Karen, doing development, our educational alliance, business development, etc. However, we haven't been together a long time. We've been doing a lot of this, using different platforms, which I find, as a silver lining for me as an addiction specialist, really helpful, because I'm still able to connect with people. Actually, more so now, because it's easier for people to, get together like this, face to face,
Right.
and have a nice conversation. It's actually less threatening, if you will, at some capacity.
Yeah, absolutely. Danny, I don't mean to interrupt you, but I wanted to introduce you and give you a little bit of your bio first.
Okay,
Before,
I'm sorry.
Yeah, before we jump in. No,
I'm
it's
a new
okay.
kid here.
And then if you could, Dan, just tilt your camera down a little bit, because we only see this much. There we go. Perfect. Thank you so much.
I'm in my COVID attire.
There you go. So, Dan Lynch has more than 30 years experience in the field of substance use disorders and behavioral health services. He is an advocate of treating both the cause and the effect of substance use disorders and he's been working with professional athletes, entertainers, high executives, and he's personally been in recovery for over 3 decades, which is amazing. He's currently the regional vice president for Karen, Boston, New England, and a certified intervention professional and a licensed alcohol and drug counselor. Now, just a little bit about Dan. When Dan came to visit Brady's Landing, I think we talked more about each other's passion for music than anything else.
Dan's a singer, right?
Yeah. He truly has a voice, and he can command an audience like no other I've seen. So that's my intro, Dan. Welcome. Thank you for joining us. I really appreciate it.
Thank you for the kind words. And it's nice to be here. And getting back to, I kind of jumped ahead, but I want to get back to how do we get the message out, right, about what's going on. And certainly using your local politicians, state reps, state senators, and onto the Congress, using your U.S. senators and your congressmen. And it's really close to my heart, because I actually had Karen, if you will, become members of the New England Council. And the New England Council is made up of thousands of companies throughout New England, where each week there is a breakfast seminar. A state senator or a congressman or the governor may speak in front of a couple hundred people. Now we're doing it like this. So it's been great for me. Before the pandemic, I was going into Beacon Street and going attending these breakouts, these breakfasts, and it allowed me to get out and introduce myself to people in other sectors, if you will, right? Finance, healthcare, you name it. And so that's one way I've been able to get the message out. The other thing is too, I don't know if you folks have ever heard of the NATAP. NATAP is a national organization who represents us, the substance abuse and mental health community industry. And NATAP is a national voice. They're our lobbyists, if you will, the National Association of Addiction Treatment Providers, NATAP.
Huh.
And, and that's another way that we can get our voice heard on a national level. And I haven't seen or been actually seen what they've been doing over the last number of months in relation to what we're talking about. But certainly, if you guys, you folks get a chance to check out NATAP, see where they are with legislation, policy, what they're asking for. We certainly do have a voice, both locally and nationally. So those are some other ways you may want to get somebody from NATAP to coin the show.
Absolutely.
So in any event,
Danny, could you tell us a little bit about your story?
my story.
Your recoveries, your
Oh
journey to
boy,
recovery.
you don't want to hear that. No. I'll give you the light version. I'll just quickly say that for years prior to stopping, not giving up drinking, I knew from the age of 18 that I had a drinking problem, but it took me another 10 years to finally admit that I had a problem. But bridging that acceptance, I finally accepted the fact that I probably can't drink anymore. Alcohol's not agreeing with me, but I need professional help to kind of help me get through this. So when I was 28 years old, December 6, 1983, wow. I went to a place called Beach Hill Hospital in Dublin, New Hampshire. And I stayed there I didn't stay a full 30 days, whatever it was at the time, but I got out on Christmas Eve day. And I remember driving home down Route 3 and seeing the Boston skyline, and the sun was going down, and it was Christmas Eve. And I was saying to myself, am I going to be able to do this? At the time, my mom had cancer. She was diagnosed with a colon cancer. That's one of the reasons why they let me out so early. So I immediately went to my mother's house and checked in on her, and then ran to my first AA meeting post-treatment. And quite simply, we don't have a lot of time. I've been doing the deal ever since, being a sober man, attending meetings, and got right involved out of the gate, got a sponsor, and did all the things that I was told to do when I was in treatment. And all that hard work that I put in the first 10, 15 plus years, going on retreats and doing 12-step work, and just really working the fellowship. And here we are 36 years later.
And that's obviously your experience in recovery is what brought you to doing what you do now, with Lynch Wellness as well as with Karen, correct?
Yes. As for those who are in sobriety, you come to realize, boy, things do get better. And if you keep doing what you're supposed to do, you set yourself up for opportunity. And when opportunity knocks, you are present, you're ready. And so I've been able to, from where I came from, living in South Boston in a housing project for a lot of years with a mom raising 5 kids on welfare, and I was a terror, to see where I am today as a sober man, having my own private practice in Norwell. I have an office condo that I own. I started my own private practice. Got in the industry working with AdCare Hospital over the years, and with Karen now for well over 15 years, becoming the regional vice president of that organization. And it's just incredible. So I got into the industry when I was, and I had no intentions of getting here. Quickly, I'll just say that I went back to school. I was working at the State House at the time, and I just wanted to get into political science. I thought I was going to be a politician. And
I can see
somebody,
that.
somebody approached me and said, "Danny, you should check out this course over here on addiction." I'm like, "Nah, I want nothing to do with that. I'll just do, you know." And somehow I got talked into it, and lo and behold, a year later, I'm in the industry, and so here we are.
What a God shot. That's awesome.
Yeah.
So tell us about what you're doing with Karen and what kind of treatment they've got set up.
Well, you know, I didn't even know what Karen was. I'm Karen who? How do you spell it? You know, I thought it was a woman's name, and it's Caron, Karen.org. And so at the time I was working for AdCare Hospital, and I was approached to interview for a job down there. So I did. And then, you know, again, that was probably between 15 and 20 years ago. And I started working there. We've built this organization, you know, Karen's been a treatment provider for over 60 years. And we treat everyone from 13 to 113. That's kind of like, you know, we have a adolescent program, young adult program, adult program, older adult program, which is phenomenal because we just built 2 years ago a state-of-the-art medical center that is like, you know, you see this beautiful building in Wernersville, Pennsylvania on the hills of Wernersville, and there's this gorgeous building that could fit right into the Mass General. You know, it's really sophisticated. And so we've been able to really hone in on our older adult population that are very sick when they come to treatment, you know. In addition to that, we have, you know, we're a non-for-profit. So part of my job is I do placement, I do fundraising, I do event planning. Every year we host a gala, which is
I was there.
Yeah, well, this year we're supposed to be in May, and we pushed it back to October. Now we're thinking we're going to go virtual, and we may have a virtual a gala this year. Stand by for that. So we have event planners that are working with us, and I'm starting to lean towards, you know, this could be really good. So I'm seeing that a lot of other organizations are doing this, and they're exceeding their goals. More people are participating.
Wow. I agree with you. It's actually less commitment in a sense, you know, where you don't have to drive somewhere or take the afternoon. You know, it's funny. I recently did a Bruins special with a colleague on Zoom, and we brought back the 1970 Bruins a reunion. We had 7,500 people watch, 7,500 views.
Wow.
Right. And on Facebook and Foxboro cable access television, of course. But, you know, we looked at it and like, wow, right. This is, you know, people are so busy and having such time constraints, and having, you know, to be able to just participate in something without, you know, taking up the entire day to from whatever. I mean, it could be a really great way to an approach. So I agree with you.
Plus, you only have to dress from the top up.
That's right. You can wear Mack Weldon sweatpants, which they always advertise on.
Well, I have to say that you know, there's nothing like being in a place with other people. There's particularly with our galas, they've been really kind of uplifting and spiritual, and people just leave there feeling really good, you know. So that piece I'll miss. But another side of that is that, you know, one of our board members, so we have a regional board as well, made up of all professionals who are friends of Karen in some different capacities. And one of them said that, he said, you know, I think this year, he says, I'd like to know that I don't have to go out on a Tuesday night for a chicken dinner, and knowing that my money is going mostly towards, now going towards the cause, the mission.
Interesting. That's a good point. Yeah.
But anyway.
Danny, tell us about, you know, because there's so many different treatment centers out there, and I'm by no means an expert or what have you, but, you know, and Chris and Kimberly can speak more to it, but what's your approach to treatment? How does Karen differ from a lot of the other facilities out there? You know, with so many different ones, advertising. what have you, everyone has a different approach, or a lot of them have different approaches. So what's your approach to as Karen?
It's interesting, and I don't want to sound like, we're not cookie cutter, that kind of thing. First of all, just think of the history. I mean, Karen's been treating addictions for over 63 years. So that in itself says something. So what I found over the years when I was consulting and out on my own, I would travel around the country and visit all of these different facilities and programs, because as an interventionist, it's my duty to put 2 or 3 treatment options on the table for families when they're looking for treatment. I still do that today. And so I needed to find out who was doing the good work, who's really doing the good work, where's the quality of care, who is ethical, how long you've been in business. I wanted to meet the chef, the therapist, the groundskeeper. I just wanted to see it all, because as you know, if I'm sending a loved one across the country to treatment, my name's on it, and
Right.
and guess what? That family member is coming back here, and I'm dealing with the family that is here. So you have to be very careful about how you approach and make recommendations to treatment. As far as the treatment, what's different? What I love about Karen is, on the front end, medical, the safety of an individual, the medical component is very important to me. That we need to get a person, by the time I get the call, they're in bad shape, physically, mentally, and spiritually. And on the physical side, you want to make sure that you're treating that individual with the top-notch detox protocol in place, so that that person can stabilize over the course of 3, 7, 10 days in a comfortable, safe way. Because a lot of people, particularly older adults, come in with complicated medical conditions: heart, kidney, liver. Nana's an opiate addict, pouring alcohol on it,
Hmm.
prescribed pain meds for 20, 30 years. So on the front end, the medical piece is important to me. The clinical team, the treatment team, they all have to be, top notch, certified. The treatment, we have, Karen also has on Sundays, they do this Sunday service, and it's just absolutely mind blowing. I've actually been there a number of times where for 2 hours I'd be sitting there crying, just watching these kids and families get up and tell their stories. And so there's a magic there with that. And then the other piece that I always look for in treatment, which Karen does very well, is the family education program. That the
Okay.
family is involved in the treatment plan. That we're making sure that we're not only taking care of the individual, that we're taking care of the family. We have a tagline that says, "The patient is the family, and the family is the patient." And so
Awesome.
those 3 things there. And my name is on Karen. And I've sent a number of close friends and closer friends to Karen over the years, and that's how much I care about them. Hope that answers the question.
Yeah, and so then part 2 of that question is how do you incorporate Lynch Wellness and maintain that kind of editorial content? So not like, tell us about Lynch Wellness and how it intertwines with
Karen.
Karen, or does
Yeah.
it?
Yeah, no problem. Now that I'm full time with Karen, Lynch Wellness is something I do in the weekends at nights, outside of what I do with Karen during the day. But they do they intersect. Again, if I'm wearing the hat of an interventionist, I'm putting 2 or 3 options on the table for the family as far as what treatment facilities would be appropriate. And so that's how I do that. And so, some in a lot of cases, the client or the family may be appropriate for Karen. So I'll certainly recommend that. But I keep it separate, and it's an agreement I have with Karen when I got together with them again, that I would still be able to do what I do best in my private practice on my time. So it's worked out well.
That's great. I mean, that sounds similar. Sorry, Kimberly. Go ahead.
No, I was just I'm probably gonna agree with you, Andy. That sounds great. I love the fact that Karen focuses on uh, the family and the patient. The patient is the I love that. That's so important, as well as the fact that they have an older, program for older adults. It's a very underserved population in the addiction industry.
Yeah.
So
Why is that? Why is that?
Why is it underserved? Danny, you want
Yeah.
to
I
take
mean,
that?
what is this? Is that more alcohol related or is that more opiate related? Why is the seniors
Because
what's the rationale for why seniors are struggling? It would be interesting
because
to know that.
so when I worked for a treatment center in Florida, they had a 35 plus program, and I loved it because it was 35 plus. But what you run into is you have people that are like executives or have jobs that they can't take that time away. They're the breadwinners in the family. This particular program allowed them to be able to get the treatment and then also to some degree be able to participate in their everyday work life, which I find is really important because it helps them balance work, a little bit of life, and also get treatment, and that's what happens. I mean, these people go back to these jobs and we know that their jobs aren't going to change. So the pressures are going to be the same. So if we give them treatment while they're somewhat still involved in job and have those pressures and give them the tools, it's just, you can't put a 45-year-old alcoholic in a group with a 22-year-old heroin addict.
Yeah.
It's not the same treatment.
That's very true. I think in speaking about even older adults, that's the type of program you have there too, Danny, right?
Yeah, and in all of our programs, and I don't want to forget about our other program down in Florida, which is a 3-month Karen Renaissance, which was a 3-month program, pretty much geared towards a younger population, if you will, that 19 to 20, 30-year-olds. And then they also have Ocean Drive, which is a signature program. Karen has two types of different programs. They have our core programs, which are the traditional 28, 31-day programs for adults, adolescents, etc. And then we have our signature programs, which are our older adult, our executive programs. For those who, like somebody just said, Chris, I believe, that if I take somebody off Wall Street, or I take a physician, or not so much a physician, but a finance person that was probably running his own company or running businesses and needs to be in touch with the outside world, while he's in treatment. We've designed programs for that population so that they can, use their own cell phone, take their laptop, and use those, and be able to use them when it's appropriate. They have to complete their treatment, their clinical day, and then schedule some time to reach out to the outside world. And so we've really designed our executive programs and our older adult. The older adults, the stigma behind it. What do you mean grandmother's an opiate addict? Well,
Right.
Dr. So-and-so has been prescribing pain pills to her for the last 30 years. Now she's lost her husband or something. She's going through grief and loss. She's got pain, and she's pouring alcohol on top of it. She's a very, very sick woman. And we have to be very careful how we treat. And, most of your older adults that come into treatment today come in with like 10, 15 different prescriptions. And they're taking all these pills and pouring alcohol on top of that. So they're very toxic, and and they come in with dementia-like symptoms. They're in walkers, they're in wheelchairs, they're on canes. And 2 weeks later, you take the alcohol, the drugs out of the system. Next thing you know, they're throwing the cane away, they're getting out of the chair, they're remembering things. And we come to find out that most of this stuff was alcohol induced or drug induced. But nobody, like the parents, the sons and daughters of these older adults, or the grandchildren, just, what do you mean Nana's an alcoholic or Nana's a drug addict? And so we're seeing we're completely full in PA at our older adult program. I think we have like 15 beds for older adults. They stay right in the medical center. It's perfect for them. And we're currently breaking ground now. We're building a state-of-the-art medical center in Boca Raton, Florida, where we're going to probably have 25 beds for older adults. Because as we heard this morning, the tsunami, the wave of mental illness, in addition to that, the wave of older adults, because we're all getting older, me included, we're all, the baby boomers. And we're starting to see a real high flow of people in need at that age group.
Yeah, that's great. I see it all the time coming through because we cater to an older female demographic too. And they come in with this just litany of different medications and ailments. But you're right. Once the toxins leave the body, they're alive again, and it's hard. It's hard for taking something you've done for 30 years and changing it as opposed to taking something you've done for 10 years and changing it, It's a little bit different. So I think it's an important segment of the population. And I'm glad to hear that Karen addresses it so specifically.
Danny, can you quickly speak to, because we could talk to you all day. You're fascinating. Can you talk quickly about insurance and, what kind of insurance do you guys take? And, and if somebody actually needs help and Karen's not the right fit per se, you can help them as well, I'm assuming.
Yeah, absolutely. Well, insurance is one of my fortes. So I always leave that to our admission specialists.
Okay.
But currently, which is great, is that we're currently using insurances now. We do a lot of work with Blue Cross Blue Shield, particularly in Pennsylvania. But the last few clients that I've sent to treatment were able to utilize their insurance from Massachusetts. So we're working with Blue Crosses across the nation. We're working with, I think we're sitting down with Aetna. Just quickly, what was happened is that, years ago, I think Doug Tiemann, had an issue with insurance companies over 20 years ago and told Blue Cross, we're not working with you anymore. We're not allowing you to dictate how we treat and how long we treat a patient. This is what we do. And so we left all the insurances on the table, and we created this philanthropy fundraising mechanism that just took off. And because we were able to put together a solid company that's in real good shape financially, we were able to provide quality care. So with the quality care, the insurance, with the epidemic of the opioid epidemic, which really kind of opened the eyes up for everyone looking at addiction now in a different way. The insurance company came back, Blue Cross came back and wanted to sit down with Doug Tiemann, and they said, we did a survey on 3 or 4 treatment facilities around the country, and you came back as the top treatment provider that had less recidivism or less relapse.
Nice.
And so now we want to sit down and work with you because we're up against it here. And so we negotiated a deal that made sense for both the insurance provider and Karen. So now we're taking insurance, and it's great because what we're able to do now is treat more people.
Gotcha.
So we are taking insurances, although I do leave that up to the admission specialists. There's an 800 number, 800-678-2332. And there's probably 10 admission specialists ready and able and willing to, take on any case that comes their way.
Awesome. Thank you.
So Danny, thank you so much. How can people reach you if they need to get in touch with you? What's the best way?
Well, if they want to get in touch with me through Karen, we do have a Boston number. I forgot it.
We'll have it on the show notes.
Yeah, it's and then certainly my cell phone. I don't have a problem with that. My cell phone is 781-544-3001. The office line, which is we have a regional office in Norwell, which is
okay.
The office I own. And that number is 781-371-8255. 5702. So that's the way you can reach me. At my email, dlynch@karen.org. And I wanted to make sure before we sign off, I don't know how much time we have, but I wanted to let you folks know about some articles and blogs that we currently have
Great.
out there that are really useful for everybody that you're in touch with throughout the year.
Great.
And if you don't mind, unless you have other questions.
No, I do have
No,
one
please
last
do.
question. I do have
Go
one
ahead.
last question, but this is more, I wanted to hear about your music career real quick, but let's talk about the information and resources that you have.
Well, I had our marketing director down in PA. I told them I was doing this today, and they were very excited. And I said, do you have some talking points or some things I should, remind you folks that we're doing, as behind the scenes, if you will. And so we have a couple. And I think I sent an email with the page of this stuff.
Yes, you got the bio.
I'll just quickly read. The articles were on Reader's Digest, MSN, The Healthy. What happens to your body when you binge drink? There's a link for that. USA Today on the impact of mental health and substance use disorder right now. Karen's CEO, Doug Tiemann, is on that link. Check it out. Today's Show online, why social distancing is the perfect opportunity for kids to quit vaping. Very, very important piece that we're dealing with. And then we have some Karen blogs. One is feeling grief over loss of normalcy, helping kids cope with schools, camps being closed, conquer anxiety without self-medicating, 7 recovery tools that can benefit everyone right now. And then on the other side, additional resources. This is a key thing. I really want you folks to take a look at this if you can. Karen launched a free digital learning platform for parents, professionals. Highlights include a nicotine cessation program, education on families and addiction, and more. Perfect for a quarantine because it's free and available for everyone. It's convenience. And then the last thing is My Child in Addiction Parent to Parent podcast. There's a link there too. So if you need me to resend those things to you, this page to you, I will. But I wanted to get that out there.
Yeah, we'll
and we'll
put it up
post
for
it.
sure.
Yeah.
Yep, we'll post it for sure. Those are great resources, right?
Yeah.
Yeah, good. That's great.
Give us a quick synopsis. You've been sober for 30 some years, and you obviously there's more to you than just being in recovery. You obviously have other things that are important in your life. What do you do in the way of music, and how has that transpired, I guess is the word I'm looking for?
Oh, thank you. And that's a part of my life, which I've been, I'm kind of setting myself up for the next song, if you will. I said, if I set the studio up, maybe I'll write another song, So I'm in the process of doing that. So I've been singing all my life. I mean, right out of high school, I had long red hair, and I was playing
Ginger.
in all the pubs in South Boston for like 10 years off and on. And then, the years went along, and I had a GB band, General Business. And I had a 5-piece band where I played a lot of weddings and corporate events. I was like the wedding singer.
That's awesome.
And then in 2010, I had a wonderful experience out in California. And I told the woman that I went to visit her facility, I said, you know what? I'm going home to write a song about you. Her name was Velvet. Ran a sober living for women in California. And I sat down in my office in 2010 and I wrote my first song, Stay in the Love. That was her tagline with her company. She always had, in all her marketing materials, stay in the love. So I wrote Stay in the Love. And that was in 2010. I got the bug. I get in the studio and I'm like, oh, this is my sanctuary right here. Oh, don't want to leave. And,
A happy place.
I've written 5 songs. The only time I've gone out is I've done last 2 years. I did 2 big concerts. It was a fundraiser for the Social Peer Recovery, in Situate, where a friend of mine owns a marina, set up a huge tent, big production. I opened up one year, I opened up for James Montgomery. I had a 10-piece band. It was unbelievable. My band was off the charts. Everybody was dancing. So the committee called me the next year. And I'm not trying to boast here, but I'm going to tell you.
Both.
They said, we don't want James Montgomery this year. We want you as the headliner. And they put a dance floor in the following year. And I had a 10-piece band, horn sections, vocalists, some of the best musicians in New England.
Like Count Basie and his orchestra, right?
Yeah, they were all Berkeley grads, and they all teach, and they're just, you send them out the charts, 2 weeks before, we do one rehearsal, bang. I mean, they were able to play. So that's what I've been doing. I love music. I've been singing all my life.
Love music.
I have 4 guitars here. I have a keyboard I'm sitting in front of. I'm able to record. I have congas. I'm crazy. I got all kinds of stuff.
We'll definitely have to get together, Danny. I just had all my music stuff shipped in. I've got my speakers and my mixing board and all that fun stuff.
Yeah, you'll be like Peaches and Herb.
Peaches and Cream?
Remember yourself, Peaches
Andy.
and Herb? Like
I remember that. I think so.
reunited and it feels
Reunited.
so good. Yeah.
It feels so good, right?
Showing your age now, buddy.
I know, right? 50.
The other thing I love is golf. I tell you, when we talk about mental illness, and I think the biggest thing we can do right now is get out and walk, get out and exercise.
Yes.
My health club has been closed down for months, but if I'm not playing golf, which is it's a 6-mile walk at the end of the day, maybe it's for shorter for those who can really play. But I'm walking 6 miles a day playing golf, and if I'm not playing golf, I'm out walking 3 miles. And I'll close with this. We're going down Saturday to a Kusnet, to a breeder, and I'm picking out a puppy. It's a fox red lab.
Oh my God.
Oh, what?
So Lola can change our life. I'm home here with my wife and 2 boys that are 24 and 25, and I'm, I got a feeling though, once the pandemic's over, I'll be left with the dog, but everybody's excited. So yeah, I'm getting a puppy.
You have to take me with you. I'm looking for a puppy or a rescue dog, one of the two.
Wow.
Got to give me that information, and I'll check with you. Will you come back, Dan? Huh?
Pause.
Okay. All right.
Pause. Yeah.
I will check it out. Will you come back and join us another time, Dan?
I will. I'd love to. I hope I wasn't too chatty. Everybody get a chance to ask the questions. I hope I covered. Try to cover a lot in a short time. So, and all of us being cooped up, I have a lot to say.
No problem. We loved it. You guys, did you have any other questions, Andy or Chris?
No, I'm really delighted. Oh, you folks. I'm sorry. Go ahead.
No, you were delighted about what?
I'm delighted that you folks, there's folks like you out there doing this. It's real important work that you're doing, and I applaud you because, we're up against it all the time. Somebody said earlier, it seems like we're on the back of the train or the back of the room. There's all these other issues that come first, and we seem to be in the back, and we're always trying to push ahead, And this is one way we can get it done. So the more vocal we are across the board, I think people are going to start to realize this is serious business.
It is serious business. Thank you for saying that. That's awesome.
Thank you.
I think that is our show for today. You can join us again on Friday at 9:30. We wanted to say thank you again, Dan, for coming on. You were wonderful and appreciate all the information and the resources. And we'll get that up, post that on our Facebook page, and we welcome you back.
Thank you. Have a great day, everyone.
Thanks, Danny.
You too. Enjoy the sunshine.
Yep. And thank you everyone else, all of our listeners, for your support of our mission. And like I said, we will see you again on Friday at 9:30, and have a great rest of your week. And you've been listening to
The Map.
Bye all.
Bye.
Bye.
Bye.